Hi everyone, and welcome back to my channel. I hope you guys are having a great day. Today we are going to be talking about how to get rid of acne and blackheads. If that sounds good to you, please make sure to like this video, comment below if you have any questions, and let's go ahead and get started. Acne and blackheads are two very common skin conditions that can occur as a result of clogged pores. They can appear alone or together and often cause distress in those who suffer from them. It can definitely affect your daily life, self-confidence, and self-esteem. That is why it's important to treat them right away when they first start appearing. So today I'll be going over what causes acne and blackheads, how to get rid of them, and some products you can use at home for treatment. Let's first talk about what exactly acne and blackheads are. Acne is a common skin condition that occurs when hair follicles become clogged with oil and dead skin cells. This can form pimples which may be red, swollen, painful, and can sometimes leave scars. On the other hand, blackheads are also caused by clogged pores, but are characterized by a buildup of sebum or oil in the pores and appear as small dark bumps on the skin. Both acne and blackheads can be frustrating and embarrassing, but luckily there are ways to get rid of them. So what causes acne and blackheads? Well, acne and blackheads are most commonly caused by clogged pores due to an excess of oil production, bacteria, and dead skin cells. Another factor that can contribute to their development is genetics. If your parents had acne or blackheads, chances are you might too. Additionally, hormonal imbalances during puberty, pregnancy, or menopause can also trigger these skin conditions. Stress can play a role in the development of acne and blackheads because when you are stressed, your body produces more hormones which can stimulate more oil production. Certain medications such as corticosteroids and lithium can also cause acne as a side effect. And lastly, using harsh skincare products that strip the skin of its natural oils can lead to overproduction of oil, which can then clog pores and cause acne and blackheads. Before I go into my top tips on how to get rid of acne and blackheads, it is important to note that everyone's skin is different and what works for one person may not work for another. Be patient and consistent with your skincare routine and consult a dermatologist if you have any concerns. Now let's get into the tips. My first tip is to wash your face twice a day with a mild cleanser. Washing your face twice a day with a mild cleanser is one of the most important steps in treating acne and blackheads. When choosing a cleanser, look for one that is specifically formulated for oily or acne-prone skin. Avoid harsh stripping cleansers that can dry out your skin and make acne worse. To wash your face properly, wet your skin with lukewarm water, apply a small amount of cleanser to your fingertips and massage it gently onto your skin in circular motions for about 60 seconds. Rinse thoroughly with lukewarm water and pat your face dry with a clean towel. Be gentle with your skin and don't scrub too hard as this can irritate the skin and make acne worse. By washing your face twice a day with a mild cleanser, you will remove excess oil, dirt, and bacteria that can contribute to clogged pores and acne breakouts. My second tip is to increase vitamin intake. Increasing your intake of certain vitamins can be beneficial in treating acne and blackheads. Vitamin A, C, D, and E are all essential nutrients that can help reduce inflammation, promote collagen production, and support overall skin health. Foods that are high in vitamin A, such as sweet potato, carrots, and spinach, can help regulate oil production and reduce acne breakouts. Vitamin C-rich foods like oranges, strawberries, and broccoli can help brighten the skin and reduce hyperpigmentation, which is common in acne scars. Vitamin D, which can be obtained from sources like sunlight, fatty fish, and fortified foods, can help control sebum production and reduce inflammation. Lastly, vitamin E found in almonds, sunflower seeds, and avocados can help soothe irritated skin and reduce redness associated with acne. In addition to a balanced diet rich in vitamins, consider taking a daily multivitamin to ensure you are meeting your recommended daily intake of all essential nutrients for optimal skin health. My third tip is to stay hydrated. Staying hydrated is crucial for maintaining healthy skin and managing acne and blackheads. When you are dehydrated, your skin can become dry and flaky, which can lead to irritation and inflammation. This can trigger acne breakouts and make existing pimples worse. Dehydration can also cause your body to produce more sebum, which can lead to clogged pores and blackheads. To stay hydrated, aim to drink 8 cups of water per day. You can also infuse your water with natural flavors like lemon or cucumber to make it more enjoyable. In addition to drinking plenty of water, avoid consuming sugary or caffeinated drinks as these can dehydrate you further. By staying hydrated, you will improve your overall skin health and reduce the likelihood of developing acne and blackheads. My fourth tip is to avoid touching your face. Touching your face throughout the day can transfer bacteria and dirt from your hands to your skin, which can contribute to clogged pores and acne breakouts. It can also aggravate existing pimples and delay the healing process. To avoid touching your face, be mindful of your hand movements and find alternative ways to occupy your hands, such as keeping them in your pockets or playing with a stress ball. You can also use a fidget spinner or other sensory toy to keep your hands busy. Additionally, avoid resting your head on your hands as this can also transfer bacteria and dirt to your face. By being aware of your hand movements and taking steps to avoid touching your face, you can reduce the risk of acne and blackhead breakouts and promote clearer skin. My fifth tip is to wear sunscreen. Wearing sunscreen is an essential step in preventing and treating acne and blackheads. Excessive sun exposure can worsen acne scars and make them more noticeable. It can also trigger new breakouts and make existing ones worse. To protect your skin from the harmful effects of the sun, apply a broad spectrum sunscreen with an SPF of 30 or higher every day, even on cloudy days. Choose a sunscreen that is oil-free and non-comedogenic, meaning it won't clog your pores. Reapply sunscreen every 2 hours or as needed, especially after sweating or swimming. By protecting your skin from the sun, you can prevent further damage and improve the overall appearance of acne scars and blackheads. My sixth tip is to use a humidifier. Using a humidifier can help prevent and treat acne and blackheads by adding moisture to the air and reducing dryness on your skin. Dry air can cause your skin to produce more sebum, leading to clogged pores and breakouts. A humidifier can help maintain optimal moisture levels in the air, preventing your skin from becoming too dry and overproducing oil. To use a humidifier, fill it with water according to the manufacturer's instructions and place it in your bedroom or any other room where you spend a lot of time. Run the humidifier for 1 to 2 hours each day or as needed to maintain optimal humidity levels in the room. By using a humidifier, you can help prevent and treat acne and blackheads by keeping your skin hydrated and reducing excess oil production. My seventh tip is to use a clay mask. Using a clay mask can help absorb excess oil and impurities in your pores, making it an effective treatment for both acne and blackheads. Clay masks are made with natural ingredients such as clay minerals, which have absorbent properties that can help draw out impurities from your pores. To use a clay mask, apply a thin layer to your face, avoiding the eye and mouth area, and let it dry for 10 to 15 minutes. Once it's completely dry, gently remove the mask and rinse your face with lukewarm water. Use a clay mask once or twice a week as part of your skincare routine to help control oil production and reduce the appearance of pores. My eighth tip is to use a retinoid cream. Retinoid creams are derivatives of vitamin A that have been shown to be effective in treating acne and blackheads. These creams can help reduce inflammation, unclog pores, and promote cell turnover, leading to smoother and clearer skin. To use a retinoid cream, apply a pea-sized amount to your fingertips and gently massage it into your skin. Start with a low concentration of retinol and gradually increase the strength as your skin becomes more accustomed to it. Use a moisturizer to help your skin absorb the retinol better. It's important to note that retinol can make your skin more sensitive to the sun, so be sure to wear sunscreen during the day while using this cream. Last but not least, my ninth tip is to see a dermatologist. If you've tried over-the-counter treatments and lifestyle changes without success, it's important to seek professional help. A dermatologist can diagnose your acne and blackheads and recommend the best course of treatment for your skin type and needs. They may prescribe stronger topical medications or oral antibiotics to help clear up your acne. In some cases, they may also recommend procedures such as chemical peels or laser therapy to improve the appearance of your skin. Don't hesitate to reach out to a dermatologist for help. They can provide personalized guidance and support to help you achieve clearer, healthier skin. Thank you so much for watching this video. If you enjoyed it, please give it a thumbs up. Let me know in the comments below what your favorite tip was and share this video with anyone you think it might help. Remember to take care of your skin and be patient with yourself. Achieving clear and healthy skin takes time and consistency. See you in the next video. Bye.